Hi, I'm Dr. Michelle Ellern. I'm a cosmetic physician that specializes in natural-looking injectables. Lip filler normally runs somewhere between $6.50 and $7.50 depending on the filler that we use. There's several different types of fillers that we can use depending on the look that we're trying to achieve. For a softer, more natural, smoothing, like liquid lip gloss kind of effect, we can use something like a Restylane Silk or a Volbella, which is a newer product on the market. For a more structure and more volumizing effect, we can use something just like a Restylane or a Juvederm. And one of the newer products, Restylane Refine, is really great for kind of an in-between, or also using as a touch-up for when you've already done a lot of volumizing for your second treatment. Depending on the cross-linking that's used, some of the newer products actually last up to 18 months, and some of the prices do reflect that. So minimizing swelling and bruising, there's several things that we can do, and both on the before the patient gets here, as well as things we can do during the procedure and immediately afterwards. So before the procedure, we ask that patients don't take aspirin, ibuprofen, vitamin E, fish oil, or other things that may thin your blood. During the procedure, we try to use cannulas as much as we can, and immediately icing afterwards, and potentially even taking an arnica tablet can help minimize the bruising effects. Also, holding off on using anything like ibuprofen or aspirin in the immediate hours afterwards would help minimize bruising. Most people do really well and have very little downtime in that regard. AccuVein is a device that we can use that uses imaging technology to be able to see the vessels in your face, so we can actually try to avoid them and minimize the risk of bruising. Also, cannulas are something that I really love to use. Basically what a cannula is, in case you don't know, is a rounded tip needle. It's not sharp at all. We do have to make a little opening with a sharp needle. We numb a little spot with some lidocaine and make that opening and place the cannula in. And because it doesn't slice through the tissues, it minimizes your risk of having bruises. So it's really nice. Afterwards, you can really enjoy your lips right away. You don't have to wait for anything to, the bruising to resolve. So swelling wise, we generally ask patients to ice for the 10 minutes immediately after the filler is placed. Icing periodically in the days afterwards can help. If you're having a lot of swelling issues, we ask that you sleep with your head a little bit elevated on the pillow. But for the most part, some people can swell, and it's just trying to do as much as we can to minimize it doing these things. For the most part, it should not really hurt. There may be some moments of being poked just because there is an injection with some lidocaine, like when I make the numbing spots on the corners of the mouth with the lidocaine. Sometimes that just a little pinch and it's not too bad. Otherwise, if people are having a lot of discomfort, or if we have to do a lot of sticks for different reasons, we can put topical numbing cream on and let you sit for a few minutes prior. Some people also do nerve blocks here if you're having a lot of issues, but for the most part, cannulas are not really uncomfortable, and we really don't need to do much in that regard. A nerve block is an injection of lidocaine into an area where a nerve comes out of the bone, and we can place it, usually for the lip area, it will be inside the mouth and a little bit along the edge inside with lidocaine. So there's an injection, and there's a slight discomfort with anything that's an injection, but you would have no sensation after that. Depending on the person and their lips to start out with, there's kind of different ways that we approach this. Very generally, somebody who has great lip volume, who doesn't need to be volumized, something like a Volbella is excellent. It's basically liquid lip gloss. Patients can place it in there and it will smooth all those little creases in your lips and just make them look softer. Patients who are older can also benefit from something like Volbella if it's placed above the lip to create a little bit of softness. It holds a little bit more water in the area and softens those fine kind of smoker lines. Something that was more volumizing if you don't really have lips, you weren't born with them, or you're older and have lost them, placing something with a little more structure to it, like a Restylane or a Juvederm in the body of the lip, will create more volume, and you can increase the size of your lips to whatever our achieved desired results are. And we will work with you on what is an appropriate ratio for your face, as well as what you're looking to achieve. Asymmetry is something that we deal with a lot. Most patients are slightly asymmetrical, some are significantly, and we can even just place filler on one half of your lip if need be, just to create symmetry with your face if you're happy with your volume overall. So there's lots of different ways to tweak the way you look with fillers, especially in your lips.